What area of nursing are you interested in and why?
I'd have to say I'm most interested in working on the med-surg unit at a hospital. The reason for that would be that in that setting, you're able to do more of the nursing skills that we're taught than you can in any other setting, like maybe a nursing home. Not just things like putting in a Foley or running an IV, but also critical thinking. The neurologic system is one that I find fascinating, so I think for me, to work on a neuro unit would be a wonderful experience.
Tell me about your clinical experiences. Which rotation did you enjoy the most and why?
I did a clinical rotation in the behavioral health unit, the pediatric unit, and the med-surg unit at 2 different hospitals. I enjoyed the behavioral health unit because I was able to put what I learned in class into a real-life situations. Sometimes I think a lot more sense can be made of what you learn when you can do something like that. The pediatric unit was interesting, but working with pediatric clients on a regular basis isn't for me. I had a hard time seeing children so young, so sick and helpless. The med-surg unit was my favorite rotation. I really enjoyed the acute care setting, and I was able to use the skills that I've been taught, and I really learned a lot. Not only about the nursing process, but about the conditions that brought the patient to the hospital and how they progress.
What is the biggest mistake you ever made and how was the problem resolved?
I think the biggest mistake I ever made happened early on in my nursing career. I hadn't been an LPN very long, and the Department of Health was doing their yearly survey at this facility that I worked at. I don't know if it happened out of habit or exactly why, but I signed that a patient had their TED hose on when they didn't. Any other day they had them on, but on that particular day, they didn't. The director of nursing had said that this wasn't the first time something like this had happened, and since that was something the CNAs are in charge of, it shouldn't have been on my TAR to begin with. In order to stop it from happening again, the facility did an audit to see what was being put on the nurse's TAR that was the CNA's responsibility to complete and sign for. These tasks were taken off the nurse's TAR, and that made a big difference for everybody involved.
Tell me about yourself. What do you see as your strengths and why?
I'm a fast learner, reliable, a good critical thinker. I'm caring, understanding, and a good listener. And I've been through every step in my nursing career. And what I mean is, I started out as a CNA and did that for almost 10 years before I became an LPN. I worked as an LPN for 9 years before I became an RN. And I feel this is a strength because I know that what my coworkers are going through in their day. I think that this enables me to better understand the processes they must go through in a day and what happens when a problem arises.
How about your weaknesses and why?
I mentioned caring earlier as a strength, but I think I can see it as a weakness too. Sometimes I get attached to the patients, and that's probably one of the main reasons I don't think I'd be a good pediatric nurse. I also think I could probably use more experience with things like IV catheters, insertions, and maybe blood draws.
Tell me about a staff nurse who most impressed you and why.
While I was doing my clinical rotation at the hospital, there was one nurse who worked on the ICU unit who would come and get me if she was doing or assisting with a procedure that I hadn't seen before, or she thought I might find it interesting. This impressed me because she was not my preceptor, but was willing to take the time to share her knowledge and experience with me. That way she could make sure I got the most out of my clinical rotation.
How would your most recent nursing instructor describe your performance in the clinical setting?
I think she would say I was knowledgeable, well organized, not afraid to perform a skill I hadn't done before. I communicated with the staff and the physician effectively. I was able to prioritize well, and I was able to get my assignments done in a timely manner.
Tell me about your most challenging clinical assignment and what you learned from it.
I'd have to say the most challenging assignment I had was during my behavioral health rotation. There was a patient that was delusional, but he denied it to all the staff. When you observed him walking down the hall, he would walk along the handrail for a while, and then he'd veer off to the middle of the hall for a few steps, then go back to the handrail. It was like he was walking around something. When he came to the windows, he'd duck down until he was past the window, then he'd stand back up and walk upright again. When he was questioned about it, why he was doing that, he would say he didn't know what they were talking about. What I learned from it was that you not only have to go by what the patient is saying, but you also have to observe their actions in order to get a full picture of what's going on with them. Sometimes patients will tell you what they think you want to hear.
What skills do you feel you have gained from your past work experiences that may help you in this position?
The fact that I was a CNA and then an LPN for so many years, I think will make me a better supervisor. They say you never know what a person's going through till you walk in their shoes. And in this situation, I really think that explains it all. A person who goes to nursing school who has never worked in this field before truly has no idea what they're walking into. Nursing school gives you all the knowledge you need to succeed as a nurse, but it doesn't give you the real-world experiences that come with being a nurse. I also started and supervised a restorative nursing program at a skilled nursing facility where I used to work, so I feel this gave me some supervisory experience as well.
Tell me a little about yourself. How would others describe you?
I think others would say that I'm kind, patient, reliable, helpful, ambitious, and I have a lot of determination.
What are your future career plans? Where do you expect to be in 2 or 3 years, in 5 years?
I can see myself working in a hospital on either a med-surg unit, ICU, or maybe a neuro unit. I can also see myself continuing my education in order to be as knowledgeable as I can. I love working with the patients, and I couldn't see myself doing anything else.
We do not have any openings at the present time in the areas in which you have indicated an interest. Would you be willing to accept a position in another area? If so, what other areas interest you?
Yeah, I would be willing to accept a position in another area. Working in the ICU, PCU, or OR would be very interesting to me. I also think those would be very good places to learn more in order to further my nursing career. The cardiac unit would be another unit I'd have a lot of interest in.
Tell me about a time when you had to establish priorities during one of your clinical experiences.
I had an assignment that consisted of 4 patients. Each was there for something different, and all were experiencing something that needed to be assessed. I needed to decide who to see first. The first person I saw was a woman who was admitted for testing to rule out an MI, and she was having chest pain that radiated to her jaw. The next patient I saw was a man who had a hip replacement the day before and had a moderate amount of bright red blood on his dressing, and his temp was 100.1. The third patient I saw was a woman that was post-op and having severe pain 2 hours after receiving a narcotic pain medication. And then the last patient I saw was just complaining of a mild headache.
Tell me about a time when you went out of your way to assist a family or patient, even though you really did not have the time.
At the skilled nursing facility where I work now, a confused patient's daughter came to me and said that her mother was missing her favorite blanket that she had brought from home. So I stopped what I was doing, went to help the daughter look for the blanket. It was not in the patient's room, so I went to laundry to see if it had been sent there to be washed. It was there, and I returned the blanket to the daughter and helped her to put the patient's name on the blanket to make sure it wouldn't get lost again.